today let's talk about few of the conditions seen in newborns. Okay, abdominal conditions. The first one is your gastroschisis. Gastro meaning yes the abdomen, and schisis means separation. So basically what happens here is that, see, this I have drawn here is the abdomen, okay guys, and this is the umbilicus. The bowel loop comes out, and why is the bowel loop coming out? Because there is a defect in the abdominal wall. Okay, the abdominal wall fails to close in a particular region that is usually on the right side of the abdomen. Okay, right side of the umbilicus, that area here the abdominal wall fails to close, and through that area the bowel loops will come out. Okay, so here one important point to remember is that the herniated loop is not covered by the peritoneal layer. You know that in our intestines are covered by a layer called as peritoneum. Yes, but here the layer that the herniated bowel loop is not covered by the peritoneal layer. Okay, let's see a picture of gastroschisis. See, this is a picture. You can see a newborn. Okay, because of the abdominal wall defect, you can see the bowel loops have come out, right? Now one more code for it. Gastroschisis, here you have R, and this defect is also seen in the right side of the abdomen, right of umbilicus. Why it happens, we don't know. Why this position of herniation occurs, we don't know. Next is a similar condition called as Omphalocele, guys. Here also what happens, the bowel loops will herniate, but where? Through the umbilicus the bowel loops will herniate, and here the bowel loop herniated is covered by the peritoneal layer. Let's see the picture. See, this here is the Omphalocele. As you can see, the bowel loops are out of the abdominal wall, right? But it is covered by a layer, that is a peritoneal layer, and this layer is in continuation with the umbilical cord. Okay, so how will you memorize it? Omphalocele has got an O and U. O and U, somewhat similar looking letters, right? So Omphalocele herniate through the umbilicus. Next we'll talk about congenital umbilical hernia. Here it is a physiological herniation of the bowel, nothing to worry about here. It will resolve on its own. Okay, so this is a picture of a physiological umbilical hernia. Next is ectopia vesicae or bladder extrophy, which means there is a congenital abnormality. And what is the abnormality? The bladder is exposed. Bladder will come out of the abdominal wall because the lower abdominal wall is not formed well. Okay, this is a picture where you can see the abdominal wall has come out. So what do you call this? Not the abdominal wall. The abdominal wall, there is a defect, and the bladder has come out. Okay, so what do you call this defect? Bladder extrophy or ectopia vesicae. Ectopy means not in the correct position. Vesicae means bladder. Okay, so this is your ectopia vesicae. Now let's learn about few differences of gastroschisis and Omphalocele. Okay, in gastroschisis, the defect is very small. It's about 2 cm, whereas Omphalocele is about 2 to 15 cm. How do you memorize that? Omphalocele has got E in it, right? Think of an elephant, which is big. Next one is about the sac presentation. I told you gastroschisis, is it covered by a sac? No. So that is never. It is never presented with or it does not have a sac associated with it. Whereas Omphalocele is always covered in a sac, that is your peritoneal layer, right? And this sac may or may not get ruptured. Next is a gestational age. Gastroschisis is seen in preterm babies, whereas in term babies we get to see Omphalocele. Okay. Next is the umbilical cord. How is it associated? I told you gastroschisis has R in it, so this defect is right of the umbilicus. See, that's what is written. It is near, this umbilicus is near the defect. Usually this defect is at the right side of the umbilicus, whereas in Omphalocele this defect is attached with the umbilicus, right? Next we'll talk about the herniated contents. In gastroschisis, small bowel, stomach, colon, all these can be herniated, whereas in Omphalocele, same thing, all these structures can be herniated, but since lot of space is there, even the liver can come out. Next is a malrotation. In both the cases, malrotation may or may not occur. Next is a bowel character. See, I told you there is no layer covering the bowel loops that is herniated, so it has more chance of getting infected, and because of that there could be edema. Okay, here in omphalocele, the contents herniated is safe inside the big bag, I would call it, that is a peritoneal layer. So there is no, it's normal, the bowel is normal here. Okay, it looks normal. Next is enteral nutrition. Here it is delayed, gastroschisis, and in omphalocele it is normal. What about associated abnormalities? In gastroschisis, it is very uncommon. I told you the defect size is very small, so the associated abnormality is also less. But in 10% of cases, atresia can occur. Whereas in omphalocele, since it is a big defect, 50% of the cases may go for some abnormalities. Okay, thank you.